The fellowship program is a year-long program. It lasts from September to September for family nurse practitioners who are new out of grad school. What it is, it just helps nurse practitioners make that transition from being a nurse to being a provider. It is a big transition. I sometimes feel like I've completely started a new job when I started this program. Of course, you still use your nursing background, but it's very, very different. As a provider, you are putting in the orders, you're making decisions. I feel like there's a lot more responsibility in caring for patients.
So as I was kind of graduating and finishing up school, I read a statistic that showed that 14% of advanced practice providers, so including both PAs and nurse practitioners, leave the career after 1 year of practice. That number even increases to 30% after 5 years of practice, and a lot of that I think is related to the pressure, the burnout, and just like the increased liability that we go from being nurses following orders to now we're the ones making these decisions and these orders and diagnoses and prescribing medications, and it can be incredibly stressful. I kind of looked into a fellowship because I wanted more support through my especially first year of training. So the fellowship at Vista is a year-long program where they ramp up your patients intentionally to kind of create a little bit more difficulty as you gain experience through experiential learning. So it starts off, you're just seeing like 4 patients a day with one of the attendings who kind of mentor and coach you through these visits.
We see patients most days of the week, and there's always an attending available to ask questions to for every patient we see. Start of the program, you staff every patient that you see, and then as you transition on, you're seeing patients more on your own.
And they slowly add more patients into your schedule as you're learning kind of time management, how to navigate complex patients, how to care for them. And you always have these mentors or coaches, these attendings, to guide you through these complex cases for further discussion.
Being part of a mission-driven organization was something that was really important to me. One of the key differences in a facility or an organization being mission-driven is having a mentality of meeting our patients where they are. The FQHC takes that into account and tries to provide either resources or help the patient kind of navigate like the complex healthcare system with, a hand to hold in thinking about what is right for the patient, what is best for the patient. I think that you really get a good feel of that in this fellowship.
I've learned quite a bit here. I think I learn something new every day. And bringing it forward is just the variety of patients that we see here. We see a little bit of everything, and we even get out rotations to women's health, pediatrics, with dermatology, endocrinology that really helps you see these more like unique patients to build confidence. And when I say this is truly family practice. I've seen newborn babies. I think my oldest patient I've seen is 92 years old. All patients from a ton of different backgrounds, tons of different things going on in their life. And so really like the thing that I'm bringing forward is just the amount of experience and exposure that I get to a variety here.
I feel like being a part of this program has been amazing. I feel so lucky and fortunate to be a part of it. Like I mentioned before, it's a big transition to becoming a provider, and having somebody there to ask questions to at all times means a lot.
I'd say to somebody who's looking into this fellowship program that you're not going to find as much like support, coaching, and mentorship in all aspects, not only like the patient side of things, but as I mentioned prior, like the professional role that comes with being a new nurse practitioner anywhere else. So I say apply. It's, I think, the best place you could work as a brand new provider.